The VML method evaluation form is divided into few sections: general personal data, general developmental profile, which includes early development, motor development profile of gross and fine motor, general sensory profile of the mouth, communication profile, language profile, speech profile, cognitive profile, social profile, behavior and emotional profile, motivation, treatment history, and parents' goals. Pre-verbal evaluation, which includes breathing control, oral imitation, and more. Single syllable production or pronunciation, which includes all the syllables. A scoring table for the single syllable pronunciation, and a digest list of all the speech skills. Complete vowel evaluation with a scoring table. Sound error descriptions to be more accurate with the data. Word forming assessment or multisyllabic assessment. And a complete CVC structure evaluation with scoring as well. At the end, VML analysis form, which help in analyzing the data, and a treatment program structure.
Yes. So the VML method.
The evaluation process starts with a preliminary phone call to obtain the basis background. Then an intake form should be sent in order to get as much information prior to the meeting. The meeting will start usually with an interview of the parents based on the intake form, while observing the child playing or interacting. The interview will include all the developmental areas, including speech data provided by the parents. Take your time while interviewing. Think about the questions. Give the family the time to answer. At this phase, you should listen and ask questions. Do not come into conclusions yet. During the interview, the examiner will make assumptions and build a thesis regarding the case. The interview will be directed based on these assumptions, trying to dispute or prove the assumptions. After interviewing, the examiner will give a short summary of the findings and present professional preliminary perspective.
And these are his skills. This is what we're going to do afterwards.
The next step would be interacting with the child while testing speech thoroughly. You need to build a quick bond with the child. The process starts with the observation through the interview. Find the strongest motivators and join the child's activity. If there's a passion for swings, go and swing the child in an interesting manner. Create few activity platforms and based on them, test the speech. Participate with the child and collect all the speech data.
With resistance.
Test the pre-verbal skill first if needed.
Yeah, good job. Come on, keep on doing.
Go over the table of syllables and imitate each consonant group, starting with word initial vowels, a, o, u, I, e, and then the rest of the consonants. You can obtain knowledge regarding the control over syllables from the spontaneous speech and conversation with the child. Write all of your findings immediately so you won't forget it. Test the ability to pronounce multisyllabic combinations. Test each structure separately with 5 to 10 words. Use the evaluation form to go over all the structures. Test the CVC structure with all final consonants.
דגל. דגל. איזה צבע? כחול. כחול.
After getting all the speech information and all the other data from the interview, organize your thoughts, analyze the information, and build your paradigm. Sit down with a parent and summarize the evaluation meeting. Start with a screening of the developmental condition and specifically speech. Show the interaction of the speech condition with other areas of development. Explain what is needed in order to promote speech based on your observation, data analysis, and interaction with the child.
Okay, if you look at this table, you can see that this is its level, and when we get to words, it just afterwards, it's not at the beginning.
Write down as soon as possible a summary of the meeting and a treatment program. An example for a summary and treatment program you can find among the lesson files. It is advised to film part of the evaluation as a reminder.
And do. And do. De. One more. De. That was a better one.